Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2024 first quarter part 5. In this video, we're going to cover two coding clinics which are related to intraoperative dural tear. So before moving toward the scenario, let us see some of the terminology which will be helpful in understanding the scenario. What is lumbar stenosis is? Lumbar spinal stenosis is a narrowing of the spinal canal, compressing the nerves traveling through the lower back into the legs. One of the most important causes of spinal canal stenosis is disc herniation. Lumbar decompression surgery. The aim of lumbar decompression surgery is to relieve the pressure on your spinal cord or nerves, which is caused by spinal stenosis. Intraoperative dural tear. The spinal dura mater is a tough fibrous membrane that protects and encloses the spinal cord. An intraoperative dural tear or accidental dural tear is a potential complication of spinal surgery. This occurs when the thin covering over the spinal cord is nicked by the surgical instrument. Now let us move to the scenario. And the question here is, a 54-year-old patient with multilevel lumbar spinal stenosis and neurogenic claudication presented for surgical treatment. During lumbar decompression and facetectomy at L4 to L5, a dural tear was identified and repaired with two sutures. Valsalva maneuver was performed twice and there appear to be no signs of cerebrospinal fluid leakage. Postoperative plans included keeping the patient flat overnight. The provider documented that the intraoperative durotomy was due to dural adhesions and epidural scarring. So the question here is, would it be appropriate to report an intraoperative dural tear in this case? And the answer is yes, we have to assign code G97.41, that is accidental puncture or laceration of dura during a procedure for the intraoperative dural tear. A dural tear is clinically significant and should always be reported when documented by the provider. Code G97.41 includes incidental durotomy. So if you go to the index and search with the main term tear, under that subterm dural, it will lead you to the code of G97.41. If you cross-check this in the tabular, it will give you a description of accidental puncture or laceration of dura during a procedure. And as you can see, it also includes incidental durotomy. Now moving towards the next scenario. A 70-year-old patient with lumbar disc herniation with severe cauda equina compression, multilevel stenosis and disc degeneration presented for surgical treatment. During bone removal in the area of severe stenosis, a small dural opening was found secondary to bone removal. The dural opening was closed with a suture as well as with fibrin glue. The provider was queried regarding the dural tear and clarified that the laceration was inherent to thinning dura and the degree of stenosis and erosion through the dura. Now the question here is, should the intraoperative dural tear be reported for this case? The answer is yes, we have to assign code G97.41, accidental puncture or laceration of dura during a procedure for the intraoperative tear that required repair. Although the provider clarified that the dural tear was inherent to the thinning dura and degree of stenosis and erosion, a dural tear is clinically significant and should always be reported when documented by the provider. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.